Welcome to the lecture for Psych 310, Abnormal Psychology. I'll be talking today about the historical context for abnormal behavior, the way that people have thought about abnormal or deviant behavior over time. So a couple of main points. One, the symptoms of most of the major psychological disorders have existed in all cultures across all time periods. So these aren't new things, feeling depressed, feeling anxious, seeing things that other people don't see. These aren't new phenomena. These phenomena have existed for as long as we know. People have recorded facts about human experience. That's true for most of the symptoms. Some symptoms may be more the result, possibly, or at least influenced by modern society. For example, eating disorders. We don't see those very often in undeveloped or developing countries. It's more of a Western phenomenon as well, cultures that are more individualistic. So that eating disorders may be kind of a newer thing, but in terms of the symptoms, even those are pretty old in terms of fasting. So denying the body sustenance in order to show kind of control for different reasons, often for religious reasons. That's a very old tradition, but related to anorexia. Okay? So this isn't new stuff we're talking about. So people have thought about these things for a long time, and what they think about in terms of the causes of abnormal behavior and how best to treat it has changed over time. It's varied across cultures, across time, and across different worldviews. But we'll try to kind of get a big picture understanding of all the different ways people have looked at abnormal behavior. We can kind of, in some ways, impose this structure and break it down into three dominant traditions. Right? The supernatural tradition, understanding behavior coming from something beyond human, right? So sometimes malevolent, kind of a evil spirit, demon possessing someone. Sometimes benevolent, having visions and seeing things that aren't there, being a gift from a benevolent higher power that bestows a gift upon you. The biological tradition, understanding that the behavior is a result of some difference in how the body is working, be it the heart, the brain, the liver, but some part of the body working differently, and that is why this person is behaving differently. And then the psychological tradition, which is arguably the newest of the three, but still has some very old roots in terms of thinking that the behavior is influenced by these kind of psychological processes. So not something that's physical and tangible, but the result of behaving a certain way, thinking a certain way, and feeling a certain way, and some sort of combination leads to this behavior. And again, how you think about the cause of abnormal behavior will directly influence what you think the most appropriate treatment is. Okay, so we'll look at this in just a little different way than your text presents it. We'll kind of go across time and see how all three traditions, so it isn't a simple progression from we thought this, and then we thought this, and then we thought this. No, all three traditions have been present, for the most part, in some form or fashion for most of recorded history. In terms of pre-recorded history, so prehistorical history, we don't know because it's prehistorical, but we suspect that it was probably supernatural belief, supernatural explanations, given we have some evidence that they seem to have a lot of superstitions and attributed certain things to supernatural causes in terms of the movement of the earth and the stars, things like that. We don't know a lot about how they felt about behavior. One piece of evidence that's a bit of a controversial topic would be trephining. We found these skulls. Well, they found these skulls with holes put in them, and it's seemingly not from an attack, but kind of surgically with sharp stones, creating a hole in someone's skull. And an early interpretation of this was, well, these are people who were exhibiting aberrant behavior, and they thought they were possessed, and they wanted to release the evil spirits by putting a hole in the head. Maybe, that assumes that these other people thought the evil spirits were in the head and not somewhere else in the body, which is us applying our own understanding of the brain to people long ago. But it could also be that this had nothing to do with the evil spirits, and this was actually early brain surgery. Maybe the people that had hematoma, kind of swelling in the brain, had this primitive surgery where they relieved the pressure by knocking a hole in their head. We don't know, but some people have interpreted these findings to indicate support for this kind of supernatural perspective. But we do know that kind of supernatural explanations for things are very old. So it stands to reason that aberrant behavior was also explained via these supernatural forces. Moving forward in time to the kind of ancient Greeks in Romans, we've got Plato in the 5th century BC, 5th and 4th century BC. And Plato wrote that maladaptive behavior was due to environmental causes. So it's the way that something going on in your environment. And in terms of treatment, kind of the psychological tradition for the cause, so psychological tradition for the treatment, not surprisingly, that you could reason with a person to provide a cure. And related to that would be Aristotle, Plato's student, who wrote about the process of associative learning, which when he wrote about associative learning wasn't really about aberrant behavior, but those writings really provide the basis for our understanding, our current understanding of behavioral therapy and of learning theory about how behavior is different based on experience. Right? And that Aristotle was one of the first people to write about that we have evidence of anyway. So some influences there carrying on into later psychological traditions. Around 400 BC we have Hippocrates, the physician and thinker, who said that it was the brain, not the heart, as I think Aristotle had said, but the brain, or maybe heredity, but also that psychological factors were probably important as well. And he actually recommended exercise as a cure. So this kind of combination of biological, psychological traditions, long time ago. So integration isn't a new thing. We're not the first ones to think of that. But suggested that deviant behavior was caused by disease, this biological cause, and that the brain was the seat of consciousness and emotion, not the heart, but that family stress could lead to these problems. In addition to all this, Hippocrates kind of introduced the idea of kind of this biological idea about the 4 bodily humors, the blood, phlegm, yellow and black bile, that when they were imbalanced, that this could lead to problems. And then Galen, the physician, studying Hippocrates' work, really expanded upon the humoral theory, and some people attribute it more to him, but talked about the blood, the black bile, the phlegm, and the yellow bile. If they weren't in the right balance, you were going to have problems. Right? So this is the very earliest chemical imbalance theory, right? And not the most accurate, but the thinking is strikingly similar to some current thinking about neurotransmitters. Right? And so if that's the problem, then the cure was to change the environment, interesting enough. So kind of a psychological treatment for a biological problem, assuming that changing the environment would change the biology, which is way ahead of its time. And we know that now, that changing how you do things and changing who you interact with can change the way your brain works. And that's a really fascinating thing. And Galen was onto that long time ago. But also did some other kind of less sophisticated things in terms of bloodletting to restore the balance and other ways of achieving the correct balance of the different fluids. Okay, so we move forward from this time, and in some ways knowledge about abnormal behavior is a lot like knowledge in other fields across the course of history, where some things seem to be going really well and kind of enlightened, and then not so good. So kind of a darker period. So moving to the Middle Ages, and we have kind of a resurgence of the belief in demonology in terms of explaining abnormal behavior, that people were possessed. And that any kind of behavior was probably the result of either sin or possession, and so the treatment for that would be exorcism. And in the old rites of exorcism aren't quite the same as they are now in the church, but generally the idea was to make the body uninhabitable by spirits, and that usually involved doing pretty unpleasant things to people. And there's some arguments among historians about whether or not this phenomenon of attributing abnormal behavior to to possession and then the ensuing treatment of it was related to this kind of conflict between the Catholic Church and the Orthodox Church, at least in that culture, and the kind of search for heretics and really about religious politics being applied to certain people. Nonetheless, it's interesting that a lot of times their treatments worked. Exorcism worked, and it could be that they were possessed, but it could also be, if the treatment, one of the treatments, hold the person over a snake pit to scare the spirit out of them. Now, if you were exhibiting some odd behaviors, maybe talking to people who weren't there, and people held you over a snake pit and told you that they had to get the spirit out of you so that you no longer talk to people, might you say, yeah, I don't hear the voices anymore? Yeah, I think I would. So when it worked, maybe it worked in terms of people no longer talking about their symptoms rather than really curing the symptoms, which is important thinking about treatments today. In what ways do we still do that? In what ways might our treatments not really change a symptom, but change the expression of it and make it less desirable for someone to express a symptom? Okay, so kind of keep that in the back of your head across the semester. But in the Middle Ages, we have that kind of supernatural stuff. We also have the ideas of stress and melancholy. The ideas of Hippocrates and Galen still be felt in terms of not necessarily the writings about abnormal behavior, but the treatments that people had, at least for wealthier people, when people were experiencing stress and melancholy and just kind of worn out mentally. They were sent to the country, right, for the fresh air and to these baths, these therapeutic baths, these spas, right? And so that implies this kind of psychological tradition is still there amidst this other kind of demonology happening at the same time. And then also still in the kind of the Middle Ages, into the Middle Ages, in the 16th century, we have Paracelsus suggesting that the movements of the moon and stars affected people's psychological functioning, which gives us the term lunatic and lunacy, right, from luna, Latin for moon. So again, kind of this other supernatural thing going on all at the same time. Again, it's not one tradition to the next. They're all typically there, struggling at once as people try to figure out why people act differently than some other people. Then we move into the Renaissance and lots of changes in the way people are thinking about the world in general. 14th, 17th centuries, leaving the Middle Ages and generally moving away from supernatural explanations for a lot of things. So less emphasis on the supernatural, so more of that, go out to the country, psychological type stuff. In terms of treatments, they did have some asylums at this point, but really not places for treatment at this time. They were more often more like poorhouses. So if somebody had what we consider today a psychological disorder that led to impaired functioning, typically the family would take care of them. But if the family was too poor, if they couldn't afford to take care of someone, they needed everybody in the family to work, on the farm typically, then they would send them to an asylum in care of the state. And so really a place just to kind of keep people alive and locked up, not necessarily treatment. Then we move into early 19th century. We see kind of the rise and fall of moral therapy. So some of the main events, we have Pinel and Poussin in France, unchaining the inmates. Right? There's the famous painting showing that. Jean-Baptiste Poussin and Philippe Pinel. Pinel being a doctor and Poussin being a former patient. They discovered that if you treated people humanely, give them fresh air and exercise, because they were locked up in these asylums, chained up, treated like objects, and so they acted poorly, like objects. But if you treat them humanely, unchain them, give them exercise, give them stuff to do. They have these dances, and they read and had plays. Some people were cured, and it was thought to be this miracle. There was people were just amazed that people who were given up as hopeless suddenly were functioning well and able to leave these asylums and go back home and be with their families. That was going on in France, and then in England we had kind of later following that Tukey in England, and then Benjamin Rush in America. Benjamin Rush, the father of psychiatry in America, kind of doing the same thing, kind of taking what they learned from them and saying, okay, well, instead of just housing people, let's maybe go back to actually some things that Hippocrates and Galen talked about a long time ago. Treat people well, give them exercise, give them activities, somehow try to be therapeutic, and maybe they will get better. And it was a beautiful, wonderful thing. And that's kind of the rise of moral therapy. Then unfortunately came the fall, which is due primarily to overcrowding. And the overcrowding occurred for a couple of reasons. In America, one of the primary reasons was the Civil War. A lot of just the number of new patients as a result of the war is remarkable. We often think of PTSD being kind of a new thing, or, oh, well, it goes back to World War II with shell shock. No, it goes back to war. War is a hellish thing, and with the U.S. Civil War, particularly gruesome in terms of the things that they saw, the things they were subjected to, the kind of emergence of surgery at this time. So a lot of people were really damaged, and families were torn apart, so they lost that support system, hence kind of this flooding into the institution. So a lot more patients, and then also we have Dorothea Dix in the mental hygiene movement, which Dorothea Dix, probably a great person, really in the mid to late 1800s, she really fought hard for better care in getting more people into asylums, out of these almshouses and poorhouses into asylums where they could receive treatment. And that was a great, wonderful thing, except she was too good at her job. She got too many people into the asylums to where they couldn't be cared for. In addition to that, so we have Civil War, we have Dorothea Dix being less successful at recruiting into the asylums, we have the Industrial Revolution. So we go from, in America, this kind of change of this agrarian society where everybody is at home, and if somebody has a problem, the family can generally take care of them. Industrial Revolution, now people work in factories, families are broken into smaller units. Now no one's at home to care for the mentally ill or psychologically disordered. So all that stuff is happening, leading to overcrowding. And then on top of that, we have this kind of resurgence of the biological tradition. So overcrowding, treatments can no longer be as effective, and then comes this, at the same time, this idea that, well, maybe there's this other way of treating people rather than just treating them humanely and giving them exercise. And that really came from several findings and events related to general paresis. Right? So early 1800s, backing up a bit, they identified this syndrome, general paresis, where typically men had symptoms of psychosis, then paralysis, and then death within about 5 years of the initial symptoms. And originally it was thought to be caused by a weakness in character or immoral acts, most probably masturbation. So again, kind of this supernatural, sinful explanation for this psychosis. Right? But then in the 1850s, people began to wonder, maybe this is related to syphilis, because they started noticing some people that had syphilis had this general paresis. They kind of, just by observing through inductive reasoning, made this connection. And then in 1870, of course, Louis Pasteur introduced germ theory, talking about bacterial infections, and that started changing the way people thought about illness in general. In the early 1900s, 1913, people found bacteria that causes syphilis in a microscope in the bloodstream. So they said, okay, well, syphilis is caused by this little organism right here. We found it. We found the cause of this disease. We think this disease is related to the psychosis. And in 1917, they discovered that they could cure the psychosis by giving people malaria. Malaria, you ask? Yeah. When you give people malaria, if it doesn't kill them, they get a very high fever, which in some cases kills the bacteria, burns up the bacteria. So you're kind of using the body's immune system, firing it up to kill some other things, which kind of led them more down the road of, okay, this biological cause, biological treatment. And then, of course, in 1928, the discovery of penicillin, and the disease is no more. So now we can treat this disease of syphilis, which cures this psychosis. And people thought, okay, well, we found this bacteria that caused this mental problem. Pretty soon we're going to find all the other bacteria and viruses that cause all other mental problems. What a wonderful day. Since then, we haven't really found any other bacteria that cause mental problems. There are obviously some things that are we've identified in terms of thyroid functioning, Cushing's disease, that relate to experience of depression and anxiety, but nowhere near kind of what people thought we would find in terms of, okay, if you have this weird behavior, we're going to find this little bug inside of you somewhere and be able to cure you. But they thought they would, and so there was this shift towards a biological understanding and biological treatments at the same time that the psychological treatments were beginning to fail for the reasons we already described. But those are the early psychological treatments. We'll talk in a minute about some of the later ones as we move into the 20th century, the 1900s. But first, we'll stay on the trail of the biological tradition. So we talk about genoparesis. So there's this growing interest in the biological tradition, biological explanations. And in the 1920s and 1930s, we began having people experiment with shock therapy for certain disorders, particularly schizophrenia. And they started this because they thought that there was an association between epilepsy and schizophrenia, a correlation, which there's not. There was bad data, bad interpretation of the data. But based on that errant belief, they thought, okay, well, if epilepsy is associated with schizophrenia, then it's this kind of electroactivity across the brain that's causing the schizophrenia. We need to increase the electroactivity in the brain to reset it, kind of like rebooting your computer, and people will be fine. So they did, the electroshock, electroconvulsive therapy, insulin shock therapy, following the same kind of the thinking. And then also in the 1930s, we had the introduction of lobotomy by Edgar Moniz. Would go and stick this sharp rod in the orbital socket and just do a little scrape all in your brain and make you all better by causing brain damage. And some people, the ones that didn't die, got better. But they got better in terms of they were no longer a problem to house in a hospital. They didn't go home and were fine with their family, but they stopped actively hallucinating and throwing things at the caretakers. They sat in the corner and drooled, and that was the wonderful cure. Of course, Moniz got his in the end. One of the patients that he treated and cured that survived the cure stabbed him. So no karma there. Fortunately, in some ways, lobotomy, although growing in popularity despite not being all that effective, lost its momentum in the 1950s because there was the introduction of the wonder drugs, the neuroleptics. Right? So this class of drugs, again, mostly for treatment of schizophrenia, that were able to treat the untreatable. And for some people, it worked. In terms of some people were able to be released from the hospital, but for a great many people, the treatment wasn't a cure. It was a way of blunting symptoms. So again, they became more manageable, more docile. But at high levels, these drugs, they cause brain damage in some folks. Tardive dyskinesia, these kind of motor disorder that's irreversible. But again, people were very optimistic about these drugs and began to think that there would be kind of this pharmacological solution to all mental problems. And if the drug makes the behavior better, then clearly the behavior was caused by the lack of the drug. Which, if you ever had a headache and taken Tylenol to cure your headache, hopefully you realize that you're not Tylenol deficient when your head hurts. But that's the reasoning that's been applied. Okay. So the biological tradition gaining strength and momentum with the discovery of these drugs started back with general paresis, but at the same time, interestingly enough, the psychological view was also having some major developments. One of which came with psychoanalysis, right? Which everyone knows that Freud, the father of psychoanalysis, but Freud we can trace back to Anton Mesmer, the father of mesmerism. You think about animal magnetism, that's Mesmer, and he was kind of a quack, and had these seances where he mesmerized people to treat them for disorders, and he was eventually discredited, but his writings influenced Charcot, who was a neurologist, a brilliant person, in terms of kind of the mesmerization process, which involved a lot of theatrics, but also seemed to induce this kind of state of hypnosis, which Charcot studied. And when they were treating people, it was typically people that had CNS, central nervous system symptoms, without a CNS explanation. So paralysis that didn't make sense, you know, to where like you'd have this like glove anesthesia where you couldn't feel anything on one hand. In the way that we know the nerves work, that's impossible. If there's nerve damage, you wouldn't have that pattern of loss of feeling. So it's thought to be this kind of mental cause, and they found that they could sometimes hypnotize or mesmerize people and treat these disorders. And then so Mesmer influenced Charcot, and then Charcot influenced Freud, who studied under him, trained under Charcot, and then later teamed up with Breuer, right, famously, to treat hysterical patients, one that had conversion disorder, and you know, developed the talking cure, where he found that eventually he didn't have to use hypnosis, but he could just have people sit down on a couch, look forward, you know, away from him, and free associate until he got to these kind of unconscious processes and experienced this kind of catharsis. And you know, the cure for the symptoms would come from gaining insight into the cause of the physical symptom, which was usually thought to be some sort of past conflict that they were repressing. Right, it's down in their unconscious that they don't know about. And Freud, not super popular in Europe, but big splash in America. We loved it. We ate it up, and really influenced American thought in many ways, beyond psychology, into kind of pop culture as well, which we still see today when people talk about Freudian slips and whatnot. But it also introduced the kind of idea of one way to think about the mind being the id, the ego, and the superego. You know, that the mind develops into these three aspects. The id being the part of you that just wants, right? It desires, it wants what it wants, and it wants it now. The superego being kind of this internalized parent or internalized culture that tells you, no, you can't have it, it's bad. So kind of a super moral, don't want these things. And then the ego is the rational part of yourself that tries to satisfy both and says, okay, you want all the cookies, you say you can't have any cookies, I'm the ego, you can have one cookie, but that's enough. Okay, so he offered this idea of the mind, pointed us toward thinking about the unconscious, which people don't necessarily think of it so much now the way that Freud did back then, but we do, most cognitive scientists do recognize that a lot of the things that influence our behavior we're not aware of. Some things that we think and we feel, there are varying levels of awareness of what's going on in our own minds. And you can think about even things like implicit memory being an example of that. So that's kind of going on in the early 1900s, becoming popular in America. And then we also have behaviorism in the 40s and 50s. We have the rediscovery of Anton Pavlov's work, you know, with classical conditioning with the dog and the bell and the saliva. Everybody remembers that story, which had been ignored for a long time, but then it was kind of rediscovered. And people like Watson and Skinner began to do studies on learning and conditioning, and develop these ideas about operant conditioning. So not just kind of associative learning like we see in classical conditioning, but the idea of we can change behavior by rewarding or punishing a behavior. We can make it more or less likely, which serves as the basis for behavioral therapy. Right? The idea that, you know, if somebody has these symptoms, if we can punish them for having the symptoms and reward them for not having the symptoms, we can gain control over the symptoms, which they've had some success with. So that psychoanalysis, behaviorism, two different schools of thought, often arguing, and then the third force, at this time, which argued with both of those as well, would be humanism, right? We have, and not humanism in terms of the philosophical movement, but humanistic psychology, with people like Abraham Maslow, Carl Rogers, which is primarily a reaction to psychoanalysis, but they also argued with the behaviorists, and kind of wanted to get away from this idea that people are at the mercy of these unconscious forces, and or the idea from behaviorism that we're at the mercy of our learned behaviors, and that we have no free will and all our behavior is predetermined. The humanists said, no, you choose your own behavior, and when you have problems, it's because you've chosen to give up your choice. Right? You're acting as people want you to act, rather than how you really want to be. And if you'll self-actualize and do what you really want, everything will be peachy keen and fine. And then that's in the 50s as well. And I don't have it here, but moving forward into the 60s, we have the emergence of cognitive psychology, which coincides, of course, with the emergence and the growing popularity of computers and the computing metaphor for the brain in America. So we have our psychoanalysis, we have our behaviorists, we have our humanists, which are about free will, and then the cognitive psych people come in and talk about the way we think, and maybe errant thinking is related to abnormal behavior. And again, all this is happening at the same time as this other biological stuff, and they're all struggling, right? And then we come to, well, where are we now in the past 30 or 40 years? Well, our science has continued to grow. We've learned a lot more things. Some things we used to think we knew, we think now, no, we were wrong. Some things we think, oh yeah, that's still right. But in terms of the three traditions, they're all still alive and well. The supernatural tradition, obviously, not a big part of the science of abnormal behavior. It's a small part. Some people study spiritual components, but generally the explanations we look at are the biological and the psychological. But the tradition of the supernatural is still very much alive in terms of the public and people's understanding of why people act the way they do. And that probably will never go away. It's an ingrained part of who we are. We're integrative now, integrating traditions, mostly against psychological and biological, but it's primarily a focus on the biological. This is due in large part to the leaps and bounds we've made in terms of understanding the brain and the central nervous system, and the development of technologies for imaging the brain and looking at brain functioning. And we don't know as much about the brain as we think we know, but we know a heck of a lot. Right? Unfortunately, or maybe fortunately, the more we've learned, really the more questions it's put forth. So we've learned a lot of stuff, but we've also, by learning the new things about the brain, it's developed new questions as well. Hopefully over the course of this semester, you'll see, as we talk about these different disorders, how each of these traditions, you'll see kind of the influence, the fingerprints of these things as we talk about our most current understanding of why people act the way they do and the best way to treat it. All right? Take care.